welcome back to The Factor Uncensored. It's the last thing you wanted to hear at this time during your summer vacation or during the summer. COVID cases are on the rise for the first time this year. They're calling it a summer wave. Dr. Donnelly Shaw-Lee from Archpoint Pain Institute joins us with the update and what you can expect before the summer is over.
Just last month in July, we saw a five-fold increase in the number of cases that we're seeing as it relates to COVID. Back in June of 2023, we're at 1.5 weekly cases per 100,000 residents here in Harris County, and that number has skyrocketed to 5.8 cases per week per 100,000 residents. So it's a significant increase in the number of cases that we're seeing of COVID here in Harris County.
Now, why are we seeing this summer wave? What's causing that?
Yeah, I think, Isaiah, it's a combination of a lot of factors. I think that folks are now their immunity has gone away, and that's number one. Number two, I think folks now who had gotten their booster shots maybe end of last year, beginning of this year, that's wearing off as well. The vaccine is wearing off. And again, the folks have given up on masks and are not utilizing that even in crowded spaces. I just came back from traveling overseas, and I can count probably a handful of folks who are actually utilizing the mask in a crowded airplane or airport.
Would that be the remedy to controlling or at least not being caught up in this COVID summer wave by wearing that mask again? Or what would you advise?
Isaiah, if you've got, again, it's patient by patient, case by case, right? If you have high comorbidities or high medical complications that you're dealing with, such as, high blood pressure, diabetes, cholesterol, things that prone you to, or even lung disease, or maybe your kidneys aren't working as well as they should, or your heart's not working. Those are all risk factors, right? Or if you're elderly population, if you're a senior citizen, you may be at more risk, or if you live in a nursing home, or if you're visiting hospitals. All of those are folks who are at higher risk. So it's all about the risk stratification in taking it case by case. But yes, I mean, if you can, if you're in a surrounding area where there's a lot of folks in an enclosed area, put that mask on. Wash your hands, carry your hand sanitizer again. Those are all things that we can help to decrease the number of cases. However, on the bright side, Isaiah, nationally, even though we've seen an increase in the number of hospitalizations related to COVID, they've seen a 10% increase nationally. We have not seen that here in Harris County. Just the recent reports I was looking at, the numbers, the graphs, do not show a significant increase in the number of hospitalizations as it relates to COVID. And so that's the good news, at least here in Harris County.
All right, Dr. Donnelly Shaw-Lee with Archpoint Pain Institute. Thank you for joining us here on The Factor Uncensored tonight.